Men over 60, stop what you're doing for a second. If you've been waking up multiple times a night to pee, struggling with a weak urine stream, or dealing with leaks that embarrass you, listen carefully. This isn't just getting older or something to ignore. This is your prostate sending a serious warning, and ignoring it could cost you your health, your vitality, even your life. I'm Dr. Matt, and today we're going to talk about the 5 early prostate symptoms every man over 60 must never ignore. Hello to everyone watching. Wherever you're tuning in from, please drop your city or country down in the comments. I love seeing where this conversation is happening, and you're not alone in this. Now, I want to be real with you because this topic is often swept under the rug. Prostate health is something most men won't talk about openly, not with their partners, not with their doctors, and sometimes not even to themselves. But the signs are there. They're whispering in your body, and if you don't listen, those whispers grow louder and more dangerous. First, understand this. Over 70% of men over 60 have some form of prostate enlargement, medically called benign prostatic hyperplasia, or BPH. That means it's incredibly common. But common doesn't mean harmless. This gland, about the size of a walnut, sits right under your bladder and wraps around the urethra, the tube you pee through. When it swells, it squeezes that tube, messing with your ability to pee normally. That's why you might be waking up at night, struggling to start, or noticing your urine stream slows or stops. 1. Nighttime urination. You might tell yourself, it's just aging, but frequent nighttime urination, called nocturia, can actually be one of the earliest red flags of prostate trouble, even prostate cancer. A study by the Mayo Clinic found men waking up multiple times per night to urinate were far more likely to have early prostate problems than those who didn't. This isn't just a nuisance interrupting your sleep. It's your body's alarm system. And it gets worse. Poor sleep caused by these trips wrecks your hormone balance, lowers testosterone, and makes you more tired, stressed, and less able to fight off inflammation. This domino effect impacts your energy, mood, and even your heart health. 1. Interrupted urine stream. Have you noticed it's harder to start peeing, or the stream feels weak, stops and starts, or dribbles out slowly? Imagine your urethra is like a garden hose. A healthy prostate lets the water flow freely. But when the prostate swells, it clamps down on that hose, squeezing it tight. This is a classic sign of BPH, and it often shows up before you feel any pain. Doctors from the Advanced Urology Institute warn these changes are the first visible signs of deeper problems. If you're noticing them, it's time to take action. 2. The dribble effect. You finish peeing, you try to shake it off, you zip up, but then you notice a little leak. It's embarrassing, sure, but this post-void dribbling is caused by your prostate not letting your bladder empty completely. That leftover urine can slowly leak out afterward, and it's a signal your prostate is inflamed or enlarged. This isn't something to chalk up to clumsiness or bad aim, it's a warning light. 3. Painful urination or ejaculation. Pain during urination or ejaculation is more than just an uncomfortable moment. It's a red flag for prostatitis, inflammation, BPH, or possibly early cancer. The prostate is packed with nerves and blood vessels, so even slight inflammation causes sharp discomfort during your most private moments. Too many men dismiss this pain or hide it, but it's your body telling you something isn't right. 4. Blood in urine or semen. If you've ever noticed blood in your urine or semen, even once, this is a serious warning sign. It could indicate advanced prostate enlargement or cancer. According to the experts at MD Anderson Cancer Center, blood in these fluids should never be ignored or left to see if it goes away. It's time to see your doctor. Men often downplay these symptoms one by one, convincing themselves it's nothing. I'm drinking too much water, it's probably a UTI, it was a one-time thing. But this silence is dangerous. Research from Harvard's Men's Health Watch shows many men don't seek help until the cancer has spread beyond the prostate, when treatment is harder and survival rates drop. Here's a myth to bust. If you don't have erectile dysfunction, your prostate must be fine. Wrong. While ED can be a late sign of prostate problems, especially cancer affecting nerves, the early signs are urinary changes, the ones we just talked about. Waiting for ED means you're already late to the party. This isn't just about preventing cancer. Prostate problems wreck your quality of life, interrupting your sleep, killing your energy, damaging your confidence and your relationships. Picture this: waking up exhausted because you're peeing multiple times a night. Avoiding intimacy because it hurts or you're embarrassed by leaks. Stress building up silently, wearing down your mood and straining your family life. Picture your prostate as a small walnut-sized organ sitting right beneath your bladder, wrapped tightly around the urethra, the tube that carries urine out of your body. It's small, but plays a huge role in your reproductive and urinary health. As men age, especially after 40 and even more so over 60, 3 major forces start quietly reshaping your prostate. Hormonal shifts, chronic inflammation, slowing cellular repair. Let's unpack each one so you understand why those symptoms you're experiencing aren't random. They're the body's response to these internal changes. Testosterone, the hormone everyone talks about, isn't acting alone here. Inside your prostate, testosterone is converted into a more powerful hormone called dihydrotestosterone, or DHT, by an enzyme called 5-alpha reductase. DHT is crucial during puberty for developing male characteristics, but as you age, this chemical becomes a double-edged sword. In your prostate, DHT acts like fertilizer on weeds. It tells prostate cells to grow, and over time, this leads to enlargement and hardening of the gland. When that happens, your prostate squeezes the urethra tighter, causing the urinary symptoms you're feeling. A study from the Cleveland Clinic found that men with elevated DHT levels were far more likely to have an enlarged prostate by age 60. But DHT doesn't just cause growth, it also fuels inflammation, which brings us to the second big driver of prostate problems. Inflammation is your immune system's way of fighting infection or injury. In small doses, it's good. It helps heal wounds and fight bacteria. But when inflammation becomes chronic, it turns your prostate into a battlefield. Your immune cells flood the prostate with chemicals meant to fight off threats. But when this response never shuts down, it damages healthy tissue instead. This chronic inflammation, called prostatitis when in the prostate, causes burning during urination, pain during ejaculation, and a persistent ache in your pelvis or lower back. Johns Hopkins Medicine warns that chronic prostatitis can weaken your immunity, cause cellular damage, and even set the stage for abnormal cell growth, meaning cancer risk increases. Think about that. Your own immune system, trying to protect you, might actually contribute to the very disease you fear most. Now, let's talk about what happens as your body ages. Your ability to repair damaged DNA and regenerate healthy tissue slows down. Imagine tiny micro-tears inside your prostate tissue caused by swelling and inflammation. When you're younger, your body repairs these quickly and efficiently. But as you age, damaged cells linger longer. Abnormal growths aren't caught or fixed as fast. This creates the perfect storm: hormonal shifts stimulating growth, chronic inflammation causing damage, and slower repair allowing problems to escalate unchecked. All these biological changes don't just stay inside your prostate. They ripple out and affect your daily life. Sleep suffers. Those frequent nighttime bathroom trips fragment your sleep, causing your stress hormone cortisol to rise. That, in turn, lowers testosterone, which affects everything from your muscle mass to your mood and libido. Sexual function declines. Inflammation and swelling put pressure on nerves that control arousal and ejaculation, dulling sensation and causing pain. This hits deep at a man's confidence and can create a cycle of stress and avoidance. Infections increase. When your prostate is swollen, it blocks urine flow, making infections more likely. UTIs and bladder problems aren't just uncomfortable. They can cause long-term damage if untreated. Emotional toll, poor sleep, pain, and intimacy issues add up to stress, anxiety, and sometimes depression. It's common for men to isolate themselves, avoid conversations, or pretend everything is fine, but that only makes things worse. The good news? This downward spiral isn't inevitable. Emerging research shows how lifestyle choices can slow, stop, or even reverse prostate problems. 1. Diet and phytochemicals. Certain foods contain natural compounds that reduce inflammation and block DHT's damaging effects. lycopene, found in cooked tomatoes and tomato products, has been shown in Harvard studies to lower prostate cancer risk by up to 34% in men who consume it regularly. Cruciferous vegetables like broccoli contain sulforaphane, which helps detoxify harmful substances and supports hormonal balance. Green tea polyphenol act as natural anti-inflammatories and may help prevent abnormal cell growth. This isn't magic, it's chemistry. These foods send beneficial signals to your cells that promote health. 2. Physical activity. Exercise is a powerful tool. Resistance training and moderate cardio improve blood flow to your pelvic region, lower systemic inflammation, and naturally boost testosterone. A meta-analysis in European Urology found men who exercised regularly had up to a 20% lower risk of aggressive prostate cancer. Plus, exercise improves your sleep, metabolism, and stress resilience, all critical for prostate health. 3. Stress management. Chronic stress drives up cortisol, which disrupts hormone balance and fuels inflammation. Simple techniques like deep breathing, mindfulness, or even a 10-minute walk in nature can lower cortisol levels and restore balance. Your prostate health is a reflection of your overall lifestyle. You can't separate what you eat, how you move, how you handle stress, and your medical care from the health of this small gland that impacts so much of your life. When you start stacking the odds in your favor, you don't just survive, you thrive. Before you go, hit like if you found this helpful. Subscribe for more honest, science-backed men's health advice. Share this video with the men you care about, because the silent crisis of prostate health deserves to be spoken about openly. And don't forget to comment where you're watching from, I read them all. This is Dr. Matt, and I will see you in the next video.